about, but just mainly for you to remember as we're talking about what's going on in the body with infections. Just remember that interleukin-1 is the endogenous pyrogen, so when you have fever, this is what's probably causing it. It's mediates beta production or production of heat from the hypothalamus. It does a lot of other things in the body too. It stimulates neutrophils to reproduce and congregate to go fight the infection. It stimulates B cells, and remember B cells are the type of lymphocytes that make antibodies, okay? And that's going to be important in a second when we talk about some of these deficiencies. And then T cells, these are the lymphocytes that produce interleukin, and then they produce T helper cells, T suppressor cells, T killer cells. And these are very important in fighting off viruses and fungal infections. Okay, the interferons, these are other cytokines that we have. There's three main ones, gamma, alpha, and beta. All of these now we can produce synthetically, and so we can also use these for treating infections, or when people don't make enough of these, or we want to try to use other agents to fight some of these diseases that we're going to be talking about. Okay, the first disease, just kind of throw at you, is severe combined immunodeficiency. You're obviously not going to have to diagnose this because this is something that the pediatrician would diagnose. But what they could throw at you is give you a patient who's got severe combined immunodeficiency. You're working in an emergency room somewhere, or they have you working in an ER, and this kid shows up, and for some reason, he needs to get blood, okay? And so he or she needs to get blood. And so what you need to know